Assalamualaikum doctors. In this video I am discussing macrocephaly, that is increase the head size, enlarge brain. So how can we take the history? First of all, onset, course and duration, growth curves, weight, height and circumference, parent head size and abnormal head shape. Then other concern, any dysmorphic features and chronic disease. CNS, increase intracranial pressure, weakness, trauma, mass, bug in brain, fits, abnormal shunt, anterior fontanelle, veins on scalp, abnormal behavior, eye about the vision, looking down, always blue eye, squint. So eye is very important, vision, looking down, always blue eye and squint. Hearing, speech, facial asymmetry, if walking, abnormal gait, if bedridden, catheter and bed ulcer source. Developmental all plus lost in skills plus learning problems. MSK, spots and neurofibromatosis and thalassemia, brownish color, depigmentation, lumps, neck swelling, lymph nodes, rosary beads, bone pain, discharge, bone carving, hair, nail, large head and foot. Then about the hematology, pallor, bleeding, bruises and recurrent bugs. FWASL, fever, weight, activity and sleep, plus sun exposure of young child or infant. Chest about the bug, snoring sound, central line, especially if rickets. The CVS exercise, pallor, awareness of heartbeat, any heart problem. GIT about the tummy size, pain and throwing up poo, urinary pee, blood pressure, endocrine, thyroid, plus neurofibromatosis, diabetes mellitus, parathyroid, thalassemia, past history, 5T, IOA, treatment, flu diagnosis, previous circumcisions, IM vaccines, bleeding. Then perinatal or birth weight, first cry, type and time of delivery, NICU admission, neonatal screening, Guthrie card and Guthric aciduria. Example. Puberty very important. Also ask even if not in puberty age, increase intracranial pressure, precocious puberty. If large private parts, ask since when. Plus complete of shorts in MS or nutritional lack of calcium and vitamin D, can try food then and nutrient. Family all plus sudden death. Like AV malformations, IEM, achondroplasia. Social and psychological. So when we find macrocephaly, what are the DD in our comes in your mind? First of familial or autosomal dominant, it is run in the family, normal mentality. So it can be familial. Syndrome like Soto syndrome, Fragile X syndrome, Canavan syndrome, Alexander syndrome and neurofibromatosis associated with macrocephaly. Bone or bone dysplasia like rickets, osteogenesis imperfecta, mucopolysaccharidosis, achondroplasia, thalassemia, then cleidocranial dysostosis, that is absent clavicle. Brain or storage disease, mucopolysaccharidosis and megaloencephaly. Space occupying lesion or hemorrhage, trauma, glutheric aciduria, bleeding tendency, Arnold-Chiari malformation and cyst tumors. C7 hydrocephalus and hydranencephaly. DD of hydrocephalus, obstructive and communicating. Obstructive are congenital aqueduct stenosis, Dendy-Walker and vein of Galen. Trauma are IV hemorrhage. Inflammations are post-meningitis, gliosis. Neoplastic are post-fossa tumor. Others are brain abscess, neurofibromatosis, tuberous sclerosis, leukodystrophy. Congenital are Arnold-Chiari type 2, downward displacement of the cerebellar tonsil, mucopolysaccharidosis, that is central stenosis, achondroplasia, narrow foramen magnum. Trauma are subarachnoid hemorrhage. Inflammation, posterior meningitis, gliosis, neoplastic are leukemia and deposits, and other are choroid plexus papilloma. Communicating, that is obstruction below all ventricles and CSF, communicating between the all ventricle and external CSF spaces in brain, not spinal cord. So any lesions at the level of foramen magnum is communicating. So we understand that macrocephaly history, how can we take? Thank you.